May is Stroke Month. Now this is very important. Why? 80% of strokes can be prevented. So this is the time where, number one, you start seeing your primary care provider to make sure that your blood pressure is well controlled, that your sugars are not elevated, and you're taking care of your cholesterol. But in addition, you have to make sure that you're exercising, sleeping, and eating well. But remember, if you show signs of a stroke, first thing you do is call 911 so you can get to the closest emergency room.
A brain aneurysm doesn't send a warning, it stays hidden. And when it bursts, it hits fast and hard, often before anyone has a chance to react. Right now, millions of people are living with a brain aneurysm without even knowing it. In this video, we're going to break down what a brain aneurysm really is, how it can lead to a stroke, and, most importantly, what you can do to protect yourself before anything happens. This isn't just theory. These are real, science-backed tips that could one day save your life. So take a moment, pause everything else, and give your brain the next 10 minutes. It could change everything. You would never expect it from someone like Carol. 59 years old, retired school librarian, quiet mornings in her Pennsylvania kitchen. She made tea, read the paper, walked her dog. No high blood pressure, no smoking. Never missed a doctor's visit. But on a Tuesday morning last fall, Carol dropped her mug. She clutched her head, staggered, and then collapsed on the cold tile floor. By the time her husband ran downstairs, she was unconscious, her face pale, her eyes fixed, and her body twitching. She never made it to the hospital alive. What took Carol away was a silent killer she didn't even know was growing inside her. A brain aneurysm. A ballooning of a blood vessel deep in her brain that finally burst without warning. Doctors later called it a subarachnoid hemorrhage, one of the deadliest forms of hemorrhagic stroke. No chest pain, no slow buildup, just a sudden, brutal rupture. Her family had never even heard of the symptoms of a brain aneurysm rupture, and no one told them she was at risk. Even though women in their 50s and 60s are statistically more vulnerable. Before we talk about how to protect yourself from stroke caused by a brain aneurysm, you need to hear this. It doesn't matter if you feel healthy. It doesn't matter if you eat clean. If there's a ticking time bomb in your head, you deserve to know. So now, let's get to the truth. First, let's understand what a stroke actually is. Simply put, a stroke occurs when a region of our brain is suddenly deprived of blood and oxygen. There are two main ways this typically happens. One, ischemic stroke. This is when a blood vessel supplying the brain becomes blocked, often by a clot. Think of it like a plumbing blockage. Two, hemorrhagic stroke. This occurs when a blood vessel in the brain ruptures or bursts, causing bleeding into or around the brain tissue. There's also something called a transient ischemic attack, or TIA, sometimes referred to as a mini-stroke. This means a temporary blockage occurs, causing stroke-like symptoms, but the blockage resolves itself and blood flow is restored. While temporary, a TIA is a major warning sign. Now, many strokes, especially those caused by blockages in blood vessels, develop slowly over many years. For instance, uncontrolled high blood pressure or unmanaged diabetes, along with inflammatory factors like smoking, can damage the lining of our blood vessels over time, leading to blockages. In the case of a hemorrhagic stroke or a ruptured blood vessel, this is also often the result of a long-term process. Chronic, uncontrolled high blood pressure and other underlying conditions can cause our blood vessel walls to harden and weaken, a process called atherosclerosis. Eventually, this can lead to a rupture. One particularly dangerous type of hemorrhagic stroke is caused by a ruptured brain aneurysm. Imagine a weak spot on the inner tube of a tire that starts to bulge out. That's similar to an aneurysm. A part of an artery in the brain balloons out. This thinned, bulging wall is fragile and can easily rupture, like an overinflated balloon, especially if there's a sudden increase in pressure. When it bursts, blood spills into the space surrounding the brain, often called a subarachnoid hemorrhage. This is a very serious event that can affect the entire brain, leading to coma, paralysis, and often death. Aneurysms often develop at the branching points of arteries in our brain because these junctions can be inherently weaker. Over time, the constant pressure of blood flow can cause these areas to bulge. Statistics from the US indicate that a significant number of people may have an unruptured brain aneurysm. Some figures suggest as many as 1 in 50 people, or around 6 to 7 million individuals in the US, with women being affected more often than men. What's crucial to understand is that most of these unruptured aneurysms don't cause any symptoms and may never rupture. However, if an aneurysm does rupture, or if someone is having a stroke, the symptoms can be sudden and severe. Beyond the typical stroke symptoms like weakness or paralysis, a ruptured aneurysm might cause blurred vision or even complete vision loss, sudden weakness on one side of the body, a dilated pupil in one eye, and excruciating, unbearable headache. If you or anyone you know experiences these symptoms, call 911 immediately. Time is critical. So, the big question is, how can we prevent this? The American Heart Association and American Stroke Association have clear recommendations. All of us have some risk of stroke, and this risk generally increases as we get older. The recommendations focus on managing chronic diseases and encouraging healthy habits. Here's what you need to focus on. First, understand your risk. Do you have a high risk or low risk? Knowing this will motivate you to make stronger lifestyle changes. Consult your doctor regularly. The American Stroke Association has risk assessment tools that your doctor can use, considering factors like your blood pressure, whether you have diabetes, or if you smoke. Knowing your risk empowers you to protect yourself. Second, healthy eating. Adopt a balanced diet rich in fresh fruits, vegetables, fiber, and healthy fats. I have other videos on nutrition you can check out to understand how crucial a balanced diet is for overall health. Third, regular physical activity. This is paramount. The American Heart Association recommends at least 150 minutes of moderate intensity exercise per week. That's about 30 minutes, 5 times a week. Or if you prefer vigorous activity, aim for 75 minutes spread throughout the week. This could be brisk walking, running, playing sports, anything that gets your heart rate up and makes you breathe harder. Fourth, maintain a healthy weight. Being overweight or obese is a significant risk factor for stroke and many other diseases. The US, unfortunately, has a high prevalence of obesity, and this trend is seen globally. Fifth, don't smoke and avoid secondhand smoke. Smoking is a major risk factor for stroke. This includes passive smoking. If you live with a smoker, you are still at increased risk. Sixth, control chronic conditions. This is absolutely vital. High blood pressure. Get it checked regularly and take medication if prescribed. Diabetes. Manage your blood sugar levels effectively. High cholesterol. Work with your doctor to control it. Gout. Manage this condition as well. All these conditions can damage your blood vessels, making them prone to blockages or rupture. It's crucial to see your doctor and take any prescribed medications exactly as directed. Don't stop or change your medication dosage without consulting your doctor, even if you feel better or your numbers improve. Seventh, be proactive in your health care. Instead of waiting until you have a problem, actively engage in your health. Watch educational videos like this, understand your body, and talk to your doctor about your concerns. Ask, I want to understand my stroke risk. What can I do? Now, what about screening? Some people ask if they should get an ultrasound of their carotid arteries, the main arteries in your neck that supply blood to the brain, to check for blockages. While this can be done, the current guidelines from the American Heart Association do not typically recommend routine carotid ultrasound screening for stroke prevention in people without symptoms. What about screening for brain aneurysms using imaging like CT scans or MRIs? The recommendation is that imaging to look for an aneurysm is generally considered only for individuals with a strong family history, such as having 2 or more first-degree relatives, parents, siblings, children, who have had a brain aneurysm. A personal history of a subarachnoid hemorrhage, a ruptured aneurysm. Certain genetic conditions that predispose to aneurysms, like Ehlers-Danlos syndrome or polycystic kidney disease. If you don't have these specific high-risk factors, routine screening for aneurysms is generally not advised, as most unruptured aneurysms don't cause symptoms and may not ever pose a threat. A stroke is one of the most dangerous health threats out there, and it can happen without any warning. It doesn't care how old you are, whether you're a man or a woman, or what your background is. A stroke happens when blood flow to the brain gets blocked or when a blood vessel bursts. And when that happens, the results can be serious, like losing the ability to move, falling into a coma, or even passing away suddenly. One of the most serious types of stroke is caused by a brain aneurysm that suddenly ruptures. And the scariest part? Most people never see it coming. What makes this even more dangerous is that the things that lead to a stroke often build up quietly over time. Things like high blood pressure, diabetes, smoking, being overweight, or not moving your body enough. But here's the good news. It's not a death sentence. You can lower your risk of stroke with small, simple choices every day, like eating a balanced and healthy diet, staying active and moving your body, keeping your weight in a healthy range, and most importantly, managing health issues like high blood pressure, diabetes, and high cholesterol. If this video helped you understand how to protect your brain and prevent a stroke, please give it a thumbs up, hit that subscribe button, and share it with someone you care about, because this information could truly save a life. And I'd love to hear from you. What's one small thing you're going to do this week to take care of your brain and lower your risk of stroke? Don't ignore it. Don't put it off. Start today. I'll see you in the next video. Take care of yourself, stay informed, and take control of your health.